in our finance department, we put together our training and development plan, and a big part of that is knowing the business and getting out and meeting clinicians and learning what actually happens on the shop floor, so to speak. So we've got our staff going out, spending time being receptionists in GP practices, going and spending a day as a domestic on one of the wards in the hospitals, working with our community providers, going out with some social workers to get an understanding of the services we commission and the pressures that face them. And also part of that is about grading of staff and understanding that that person who sits on reception in the outpatient clinic is sitting there on a band 2 or a band 3, and the pressures they deal with and the tension that they have, comparing it back to when you're sitting in your office and what you think's a worry for yourself isn't possibly the same pressures. So as part of that, within our CCG itself, we thought we're not even that familiar with what everybody else does. So we got a commitment from all the departments to do a sort of show and tell session, whereas each department would do a lunchtime session, would put some food on, bribe people to get there, and talk through what your department does. And we were the 3rd or the 4th in line for this. And we'd been to some of the previous sessions, and they followed the standard format of presentations, and like Chris was saying about death by presentation. Very interesting, but you do switch off a bit and become a little bit bored at times. So we thought what we'll do is we'll kind of up the bar and do something completely different. And that's where Show Me the Money comes in. So the aim of the session was that we needed to increase financial awareness and improve financial knowledge, and that kind of went without saying. But we also wanted to do some less tangible stuff about building relationships with our clinicians, with our commissioners, and take the mystery out of the numbers and show our human side. And it's good to talk. We wanted people to come and talk to us, and I wanted the finance team to go out and talk to people. There's nothing worse than when I walk into the finance department and they're all sat at their desks. I want them out in the other departments, speaking to people, getting to know what's going on in the business and being that finance enabler and partner rather than just someone who does the numbers and tells them how much they've overspent this month. So the content covered a whole range of the finance responsibilities. So we looked at things like budget holder responsibilities, the prime financial policies, where do we spend our money, who's responsible for things. And in a different range of things, we had games that people could play. So we had Who Pays, which was money doesn't grow on trees. So we had some trees laminated with things to stick on of who's responsible for. So if you go to the dentist, who pays for that? But if you go to the hospital to have your wisdom teeth removed, who's responsible for paying for that? Who pays for child health vaccinations? All that sort of thing, which was quite enlightening for a lot of people, because if you're not dealing with it personally yourself, or some people really weren't interested beforehand, if who pays, you just assume it gets paid for, you don't need to worry about it. Who you're going to call, I think links in with some of the things we've already talked about. It's sort of, who do you want to speak to in finance, what do you want to know, and who do we need to speak to? So that one was obviously on a Ghostbusters theme, and a demonstration around that. Play your cards right, and I'm not sure if everyone remembers Play Your Cards Right now. I'm showing my age, I think. But the sort of higher and lower we did with our contract values. We've got 8 provider trusts within the city in Liverpool, so we put them up on a higher or low with their contract value. Again, that was sort of quite an eye-opener to some people of who we pay more money to than they might have thought. But that could be adopted around a whole load of stuff, I don't know, consumables within the theatre, different prostheses and stuff. Just gets people thinking about it, and there's a bit of fun involved. We had pin the price on the body, so we had an outline of a body with some procedures and prices to stick on to see, does a hip replacement actually cost more than a CT scan? And people's sort of thoughts about that was quite interesting. It didn't necessarily follow what you would think. Again, we're going to adapt that in a sort of pin the price in the office, and we're going to have an office layout. So how much is it to have a colour print set out? How much does it cost to raise an invoice? How much does it cost if you don't raise the purchase order and we have to chase that up, and things like that. And then Can You Speak Finance was trying to break down the acronyms. That was one of the quizzes that we did. We've introduced some drop-in clinics. Some of the feedback was that sometimes people felt that they couldn't always approach the finance staff. They were busy, they knew we had busy times of the month. So what we've done is we've got a dedicated afternoon once a month for a drop-in clinic when we've got coffee and biscuits. Obviously the bribery helps again, and people come along and ask questions. It's not to say they can't speak to finance anytime the rest of the month, but they have that sort of formal session that they come in and just have a chat if they want. We've developed an ongoing training programme, picked up some of the needs that were highlighted in the sessions, both formally and informally. So we have a number of things throughout the year. We've signed up, well, we've been part of the HFMA, e-learning anyway. We encourage people to do that. And we've got some formal training for budget holders. But I think possibly the biggest thing for us is we've now got sign up in the organisation that finance is now mandatory training for us. Same as IG, same as safeguarding, every member of staff has to do some finance training. So we're putting that package together, and whether we do a combination of a more taught thing or show me the money again, we're not quite sure, but that starts from April, so we need to do a bit more work.